get the swine flu. I know the vaccine for me won't be seen. I'm a working stiff who don't meet the criteria, like CEOs, politicians, and hockey teams.
ONA's November 2009 Provincial Coordinators Meeting included a much-needed H1N1 update.
The employer has a responsibility to ensure there's a plan and that it's communicated and people are trained in it. And obviously,
public health nurses had worked tirelessly throughout H1N1, even as some bargaining units went down to the wire in negotiating or the arbitration process for new contracts. ONA's earlier success regarding the mandating of safe equipment, i.e. N95 masks, was put to good use, as some employers were reluctant to supply the necessary safety equipment. The PCM's Human Rights and Equity Caucus was a big success.
I think that we're making progress. I've been coming to these caucus meetings for years, like back in the 90s when they first started, and I've seen a lot of changes over the last 10 or 15 years. I really, truly have. And we're still fighting for different things, but we all basically have the same issues, and we're all willing to work with each other to try to solve the issues.
We all have very similar issues. They may not be totally the same, but we do have similar issues, and that if we all stay united and work together, that I think we can make some inroads on them.
75 to 95% of bullies have no idea what their impact is on other people.
Workplace bullying is getting increasing recognition as a serious problem, and ONA has been responding, including with education programs. PCM delegates were delighted to welcome the representatives of 157 new ONA members. After a hard-fought 2-year organizing drive, the nurses of Strathroy Middlesex General Hospital voted overwhelmingly to join ONA.
So we needed a voice, and we weren't being heard in Strathroy, so that's why we chose ONA. And I got to work the weekend after ONA was voted in, and for months and months, you know, everybody came into work, and the weight on us was so heavy. And it affected our patient care. Patients were even saying something, and to us, we didn't even feel we could back each other up. Well, that weekend, everybody was smiling. I don't think we ever worked so fast and so hard in our lives that weekend, but everybody still smiled, and it's just been a great experience. And thank you for allowing me to, and Lori too, come to this meeting, because I'm still learning and learning and learning. So, and I look forward to keep learning and bringing this back to my staff members.
So on behalf of our 55,000 members, we welcome the RNs and RPNs from Strathroy, and so welcome.
Thank you. Thank you so much.
ONA's 12,000-strong student affiliate membership was a strong presence at the PCM. ONA's services for students now include access to an expanded student affiliate members section on the new website and regular updates in front lines, plus participation in area coordinators meetings, provincial coordinators meetings, biennial meetings, and more. ONA continues to liaise with affiliate leaders on a range of issues. Liaison with student members took a very practical turn when National CNSA President Tyler Cook did a practicum with ONA, working with Linda Haslam-Stroud.
As a nursing student here in Ryerson,
ONA hopes that students will become enthusiastic and engaged members of ONA when they graduate with their new understanding of what the union stands for. ONA's website has been redesigned to engage both students and members. Now launched after the extensive redesign, it is easier to navigate and more comprehensive. Many ONA videos are now available to all members on the YouTube website. Do a search for Ontario Nurses to find our videos. ONA has experienced many successes and will continue to do so. A recent campaign to preserve allied health members' jobs at Lakeridge Health was successful. And the Independent Assessment Committee hearing recently held in North Bay regarding staffing levels at Castleholme Home for the Aged garnered supportive media attention and community understanding. Continuous efforts to get cutting nurses, cutting care messages out have had an impact. Ontarians are on the side of nurses. London Health Sciences Centre's plan to cut cancer program registered nurses has seen an enormous backlash. The public has mobilized to fight the cuts and has won at least a temporary reprieve. To continue to fight cuts successfully, you have your union's assurance that we will be out front, speaking to politicians, the media, working with other stakeholders. But we need our members to become involved too. As we move forward in 2010, we will be looking to our members more than ever to become fully engaged in the advocacy work of our union, to protect our jobs and our patients. And we look forward to your continued feedback about how we can work together to accomplish these goals.